Hello, I'm Dr. Ramsey Amin, and I'm going to speak with you today about dental implants and how long they require to heal before you can have teeth. One misconception of dental implants is that you can have a tooth on the same day on any implant, and the other misconception is that all implants take 6 months to a year to heal. It really depends on the particular situation. Healing has got a lot to do with how hard or how soft your bone is. In general, the lower jaw is harder than the upper jaw. The harder the bone, the faster the implants heal, generally speaking. So if you're having a lower implant done, that will be healed and ready to have a tooth put on it faster than an upper would. The lower jawbone has the consistency more like dense wood or oak wood, and the upper jaw sometimes can be as soft as styrofoam. So the other generalization to speak about is implants in the front of the mouth typically can have teeth on them faster than implants in the back of the mouth. That's primarily due to the bite force that's generated in the back of the mouth. It's much higher when you chew in the back than it is in the front. So having implants done in the front of the mouth generally goes a little bit faster than it does in the back of the mouth. Things to consider is if you have multiple implants, it is possible to make the teeth on the same day. That's called immediate loading of implants. That means the implants are put in and temporary teeth are put on the same day. The cautions there are to make sure that you don't chew any heavy foods in the area and that your bite is checked out very carefully during this process. That process is much more risky. It is a process that I do quite routinely, but it has to be really diagnosed and treatment planned very carefully in order to make sure that you don't have a failure. My own success rate is in the high 99%. In order to achieve that, obviously I make sure that we have a patient that's very compliant, that you know what you're doing before we start, and we also have predictability in studies and literature to back up what we're doing. An implant goes through a process called osseointegration. That means the implant will fuse to your jawbone and become kind of one with your jawbone. That process for most of the time takes approximately 4 months. A little bit shorter on the lower jaw and sometimes a little bit longer on the upper jaw. If you've had a bone graft, and you can find a lot of information on my blog about bone grafting, if you've had a bone graft, it may require a longer period of time for the implant to heal because the bone is new. It needs to heal and become strong and solid before it's really safe to put an implant on. So a bone graft may require that your implant takes longer to heal. Sometimes the bone graft is done at the same time while the implant is put in. Sometimes it's done in stages. If your bone is really, really thin, oftentimes the implant has to be done. The bone has to be added first, then the implant can be put into the wider or taller bone. Whereas if it's just a little bit skinny, bone can be generally added and an implant can be inserted on the same day. From a healing standpoint, most of my patients are fine by the second or even the first day after the procedure. It just takes the time for the body to accept the implant, for it to become united with the bone so that a tooth or bridge can be made on the implants. One area that we really can move quickly on is if you're missing all of your lower teeth. All of your lower teeth, if they need to be replaced with implants, can, I would say, almost always have teeth put on the same day, meaning fixed teeth that stay in place that don't come out. You can go from having dentures to full teeth on the same day, fixed in your mouth that do not come out in a one-day procedure. The other area that's very common that I do is anywhere in the front of the mouth, or front teeth, top or bottom. One of the primary reasons for that is cosmetics. Obviously, missing a front tooth can leave you in an embarrassing social situation or having something removable. So if it's predictable and feasible, I'll talk with you about replacing your front teeth with same-day dental implants or same-day teeth on the implants. If there's any questions, please feel free to comment. I'll make sure to reply back to you. I appreciate your time, and thank you very much. This is Dr. Ramsey Amin.